Hey YouTube, new video. On this one, it's going to be a little bit special. What I'm going to do is, recently been on Discord. A lot of people has been asking me which book to buy, or do you recommend this book and this books. And reading some of them, like they're very good. Some are not so good. But it got me to think that I never really did a video on what I would recommend. And then I started to like, okay, so let's say somebody has a little bit of money, how would they start? And one of the thing that with the books that are out there, especially what they call survival medicine, is well, like I said in the past, I don't believe in that term. I don't think it exists. You cannot really go to school to have survival medicine. It's more a clickbait kind of thing. They want you to buy their books, not the other books. And because I prefer Oster medicine, that has a title, that has courses, that has support, that has some studies, and it's a little bit better for that. But what it got me to think is that a lot of time in those books, it's a little bit like going to college without going to high school first. Is that they jump straight to, and a lot of them, and there's nothing against professional, so like doctors and things like that, is that a lot of time they're writing by professionals, mainly doctors. And what happens with those books is that they're very medical oriented. So they'll be talking about suture. They'll be talking about antibiotics and lists like that. And then people get kind of focused on that and kind of forget that there's other things you can do. So, for example, if I think pneumonia, a lot of people say, "Oh, pneumonia, but just give antibiotics and that was it." Well, there's pneumonia existed way before antibiotic existed, and there was ways of treating it. And this is where nursing comes along, as before a lot of the antibiotics were existed, or other medicine existed. Nursing was during the Civil War, during a lot of the other wars. Nursing was what making a difference in the scales. And people would say, "Oh, you're preaching for your own profession," but it's not so much that preaching for my own profession. Is that when you look at your mom or parents taking care of you when you were sick, they were kind of doing nursing. And what they were like in critical care where I work, a lot of time we'll do what we call rounds, where basically the doctor comes and we do a review on the patient, and they'll spend about an hour, write all the orders and stuff. But the rest of the 23 hours of that day is nursing, assessing, checking, evaluating, doing some cares that will help the healing process going on with also other healthcare professional, like physio and respiratory therapists. But the nursing component is a very big part. And a lot of time in those books, they don't talk about that. So what I thought I would do is make a list of books that I think, before you start reading, again, before you go to college or university, maybe you would want to read about those books. And the reason is that it will give you a better understanding. There, one, there are things that are kind of easier to learn, like setting somebody up. You don't need a prescription for that. You don't need to go to school too long, but you just need to know how to do it properly and why you're doing it and when to do it. And this is what a lot of time nursing school is about, is learning those process. And we even have what we call nursing diagnostics, where basically is if somebody, for example, come with what the medical world will call asthma, at nursing will do what we call a nursing diagnostic, is we see the person having trouble breathing. So asthma, you would be giving the Ventolin and all those treatments. But as a nurse, I can also start setting this person up. I can make them exercise. If they're wearing a shirt or something that is very tight, I can release it so that their muscle, their breathing muscles kind of goes up a little bit and improve their work of breathing. So all of those are things that I can do, and I don't need prescription, I don't need antibiotics, and I don't need other medications or anything. All I need is an understanding of the disease that I see in front of me and what I can do. And then when I can give medication, which one and how to give. So with this in mind, what I did is I went on to Amazon, and the Canadian, obviously, that's the one I have. And I did a list of books, and I wanted to keep it around the $100 mark. On the Amazon, that didn't quite work well, because even the ebooks were pretty expensive. Was almost no difference. So obviously, if you have a chance between ebooks or buy the actual books, buy the actual books. But the books that I will recommend, a lot of them are accessible by going to nursing schools, or we're talking about nursing in general, but any schools that have like healthcare professional teaching, so doctors or nursing. And a lot of time by the end, like when I used to study nursing, after the first year, many of us didn't want to keep all their books, so we sell them. And so it's very easy to buy some used books, and that becomes a little bit less expensive. So what I'll show is a list of the bunch of books that I watch on Amazon. So basically they would be brand new. And if you want a little bit cheaper, just a quick look that I did is a quick search. But again, if money is a little bit tight, you could look for them, and you can always find good deals, and they don't have to be recommended by the ones that I recommend. But it's just that I know those ones. I looked at them, and I reviewed them a little bit with the samples that you can get when you buy ebooks, and that's why I did those recommendation. So the first thing, so for example, if I go on the Amazon, the first one that you'll see over here, it comes to about 227, and that is in Canadian dollars, so that's about $5 US. But so the four books that I have here, or the first they come in, and you'll see it covers a lot. So nursing assessment. So basically, this thing here is a little chart that tells you how to do your assessment, words that you can look at, and kind of a little bit charts. If we look over here on the look inside, so you see it's very tight, but basically how to take in history, technique, physical examination that you need to do with it, neurologic system. So obviously they're not to teach you how to do an actual assessment, but if you practice those in before you get to do some research and practice those before an event happens, well, then having this little, and I think that's about $6 or $7. Yeah, it's $5.95 US. Then it's a very useful tool to have, and very easy to put in a kit because it's kind of folds and it's plastify. So I would have one of those. The next one here is Pharmacology, Made Incredible Easy. So the Made Incredible Easy are awesome book, and actually I have two on this list, and they're very colorful. There's very well researched information. I've used them many times in the past, and so that's why. And they're made for people that it's a little bit like this for dummies sections, but obviously made for medical. So this one here, the Pharmacology Made Incredible Easy. We'll skip this part here. There you go. So as you can see here, you got like fundamentals of nursing pharmacology, and then it goes through different systems: the respiratory drug, gastrointestinal drug, hematologic drugs. A lot of those you wouldn't need in this situation, but for example, let's say it's a real disaster, and you have access to a pharmacy, or people are bartering some medication. Then you could look at them and you could understand how they work. Or somebody in your group gets sick and they are using certain endocrine drugs, and you want to understand what they are and things because you're the person with the knowledge. Well, then you can have those. The other thing too that they have in the great section that I would recommend most people to read is drug for fluid and electrolyte balance. And sometimes it's more complex than a lot of people think that just giving normal saline and that's about it. You'll see that there's way more fluids and different electrolytes, and so usually they're pretty complete chapter. So this is why I would recommend this one versus just a card on it, or just a manual on how to read different antibiotics and drugs that you have. It's just this one you kind of understand a little bit more of the pharmacology, so it's kind of important to understand how they work. But as you can see here, you see the Kindle is $55, and actually for whatever reason a new book that is hardcover is $51, so or it's almost to buy it and get it ordered, so that way you can keep it, so if the grid goes down you don't need to have. The next one, obviously, wound care, because that's the big part that probably 80%, if you would be in a situation, will be what you need to do, and that's where you'll be able to do the most difference. And so in this one here, again, it's a lot of pictures explaining a lot of things that I kind of talks into my videos, but also they'll go into a little bit more atypical wounds, malignant wounds, things that you don't really, what we call chronic wounds, so vascular ulcers, pressure injuries. That one actually you may be something that you'll encounter if you're having to take care of someone that cannot mobilize very well in acute wounds. So it's mostly that chapter. But like I said, as you can see here, a lot of nice picture, very well colorful. They kind of make it funny a little bit with like comics or cartoons that explain things. But it's well explained. It's very easy. A lot of illustration, so it's not kind of. This is why I chose those books, is that they're not too dry, and they explain very well, and it's very. I'm a visual person as well, and so for example, you see here sensory perception pike, so you can kind of connect your situation with that. So as you can see here, the skin as well. So they're a very nice series, very well done. But with those ones, this is why I recommend those two, is that pharmacology, so the pills that you would have to give to understand painkillers and things like that would be very important, and wound care would probably be the most thing that you have. And one that I don't hear often talk about, and this is what the one that kind of skyrocketed up the price, is clinical nursing skills. And so why do I recommend this one? So first of all, Perry Potter, I think it's the one that I've learned when I was in nursing school, so that's why I kind of, and it's the Canadian, this one, clinical nursing, but I think there's one that says Canadian on it. And one of the reasons that I recommend the nursing skills is that things like how to bring somebody in bed, how to turn someone into bed, how to sit someone at certain degrees, what we call the semi-Fowler positions, are all things that if you do appropriately and you don't really think about, but they will help, and there will be need to, like, for example, if somebody break their legs, if you take any of those wilderness medicine books, or again that are very medical oriented, well, they'll talk about is how to heal the wound. So with like a splinting and stuff, which is great, and you really need to do that. But now your wound is splinted and your fracture is splinted. What do you do next? How does this person stay in bed? How does it mobilize? Exercise for the breathing. How to turn somebody, if they cannot walk on their legs, how do you turn them? For example, if you have a portable toilet, how do you turn them from the bed to the toilet without hurting yourself? All those are what we call clinical nursing skills and techniques. And so usually it's like the first year of nursing, that's pretty much all we learn about, how to administer. So like in medication, a lot of time people talk about antibiotics and which one to use. But if you would get a list of or get your hands on an antibiotic that could be given intramuscular, how do you give an intramuscular? Well, a lot of those clinical skills would be taught in those books. And again, books obviously don't replace learning and doing and all that stuff, but having the resource would be an advantage that many people wouldn't have if you just buy books that tells you how to treat X, Y, and Z, because the treatment is important. Yes, it's maybe a 20%, 30%, but there's another 80% of the time, or 70% of the time, that there's other things that needs to be done. The person needs to be fed. So how do you feed somebody that is unconscious? How do you take care of bowel movements? Because people will pee and people will have bowel movements, and so now that they're stuck in bed, how do you deal with all this? And so a book like this will cover, and this one I kind of review it with the downloadable version, and like I said, I've used it in my nursing, and very well image. A little bit more dry, obviously. It's they talk about the research and things like that, but the pictures are decent, and they explain very well. So again, for this time, like on Amazon, that was about $227. But if I go on eBay, it says $200, but that's because I'm in Canada and most of those things are in the States. But if you look, for $100 Canadian, so a lot of those books now. So for example, the other books that we just saw, that was like $100. Now for 65 US, I can buy like the old version of it. The chart that we were talking about, you can have four for $8 because they're used. The pharmacology book that we had for about $30, I think, or $50, sorry, now it's $4.99. So like I said, if you pay attention and you go to a place like eBay, or even go on sites with schools, you may get better deals than that. But those are about the four things, because with that, basically, then you'll be able to build the rest. So if you buy, like, let's say the book that I often recommend, the Field Guide to Wilderness Medicine. So now you could apply your medicine to your so that 30% that you would be missing if you just applied those books, now you can apply it. So if you give an antibiotic and you understand why you're giving this an antibiotic and not this one, and again, it's learning that you can get by books. It's not replacing full going to school and things, but it would give you it would give you a little bit more powerful situation. So anyway, I hope you enjoyed this video, and I'll talk to you soon.